What will your menopausal years look like? Will you be quick and agile enough for a game of tag with your grandkids? Walk or go hiking with your pets? Strong enough to embrace every moment? Will you transition through menopause with vitality? Or will you grow old quickly, weakening, slowing down, and developing heart disease? In these next two videos, I will provide you with a heart health strategy that includes appropriate heart health checks you need to reduce the risk of heart disease, even though you think there's nothing to worry about. A healthier lifestyle as you transition and will spend 30 plus years in post-menopause is so important, as aging and loss of hormones can take its toll. And perhaps you unknowingly have a higher risk because of other factors like hypothyroidism or diabetes or being overweight, for instance. According to the American Heart Health Association, or AHA, the lifetime risk of developing cardiovascular disease for women at age 50 is about 39%, meaning nearly 4 out of 10 women will develop heart disease, including heart attacks. When you're in menopause, contributing factors to heart attack risk include, as I mentioned in previous videos, the decline in estrogen. Then there are the more well-known factors like hypertension, high cholesterol, diabetes, obesity, physical inactivity, smoking, and an unhealthy diet and stress. And then there are overlooked symptoms or preconditions. Overlooked symptoms that may or may not be related to heart disease are shortness of breath, fatigue, sleep apnea, edema in the ankles and feet, indigestion or gastrointestinal issues, jaw and neck pain and back pain, dizziness, excessive sweating, persistent cough or wheezing, heart palpitations. Overlooked preconditions, chronic inflammation, autoimmune disorders like rheumatoid arthritis and lupus, chronic kidney disease, mental health issues, PCOS, psoriasis, metabolic syndromes like NAFLD or non-alcoholic fatty liver disease, and oral health issues like gum disease or infections and inflammations in your mouth. Hypothyroidism is categorized as an overlooked precondition, which increases the risk for heart disease and heart attacks, especially in postmenopausal women. Hypothyroidism becomes more common with age, and women are particularly susceptible due to hormonal changes. It's estimated that about 10 to 20% of women over the age of 50 may have some form of thyroid dysfunction, with hypothyroidism being the most common issue. Managing the combined impact of menopause and hypothyroidism on heart health involves a multifaceted approach that includes, first, hormone therapy; second, lifestyle modifications; number 3, regular monitoring for heart health. And the good thing is lifestyle modifications and awareness will help you if you have one of the other preconditions I mentioned earlier. Also, the hormone replacement therapy that I'll talk about more in the second video is protective. So here's the comprehensive strategy you can follow. So first, medical treatments that help balance your hormones. And in this case, I take hypothyroidism as the precondition. If you had another precondition, you would take the appropriate treatment for that condition. For hypothyroidism, thyroid hormone replacement therapy is essential. Levothyroxine is a synthetic form of thyroxine, or T4, that is chemically identical to the T4 hormone produced by the human thyroid gland. Its molecular structure matches that of the naturally occurring thyroxine hormone, making it bioidentical. This treatment helps normalize thyroid hormone levels, which can help improve cholesterol metabolism, reduce symptoms of hypothyroidism, and potentially lower cardiovascular risk. I personally take a hormone replacement for my thyroid from Canada called ERFA or ERFA thyroid. And alongside this, I follow a protocol that I will talk more about in this video series later on. Here's why I prefer ERFA. First, composition. ERFA thyroid is a natural desiccated thyroid or NDT product derived from the thyroid glands of the porcine family. It contains a combination of both thyroxine T4 and triiodothyronine or T3, along with other thyroid hormones like T1 and T2. Secondly, the hormone content. ERFA thyroid provides both T4 and T3 in a ratio that's more closely resembles the natural production of these hormones by the human thyroid gland. This can be beneficial for patients who do not adequately convert T4 to T3. Number 3, bioavailability. Some patients report feeling better on an NDT product like ERFA thyroid compared to synthetic T4 only medications. This could be due to the presence of the T3, which is the active form of the hormone that the body uses more immediately. In the second video, I will go into more depth on balancing the sex hormones that decline when you are in menopause: estrogen, progesterone, and testosterone. As I mentioned, managing these hormones is essential as they protect us, and the combined impact of menopause and hypothyroidism on heart health involves an approach that is multifaceted and includes hormone therapy, lifestyle modifications, regular monitoring and checkups of your heart, stress management, and education and support. So now, what about lifestyle modifications? Which ones should you be aware of and implement immediately to get the best possible outcome? Number 1, diet. Adopt a heart-healthy diet rich in fruits, vegetables, lean proteins, and healthy fats like those found in fish, nuts, olive oil, avocados. Avoid or limit intake of saturated fats, trans fats, and sugars, which can worsen cholesterol profiles. Number 2, exercise. Regular exercise activity can help improve overall cardiovascular health, aid in weight management, boost metabolism, and improve your mood. Aim for at least 150 minutes of moderate activity and 75 minutes of vigorous activity per week, alongside with muscle strengthening exercises at least 2 or more days a week. Number 3, weight management. Maintain a healthy weight to help manage both hormone levels and cardiovascular risk. Even a small weight loss can have significant health benefits. Number 4, smoking cessation. If you're a smoker, quitting is one of the best steps you can take for your heart health. Smoking is a major risk factor for cardiovascular disease and can exacerbate the symptoms of menopause and the effects of hypothyroidism. Now, regular monitoring and checkups of heart. If you are at higher risk of heart disease due to menopause and hypothyroidism and are undergoing a hormone replacement therapy or HRT and taking thyroid hormone, several specific heart tests can help assess your cardiovascular health. I'm going to go over some commonly recommended tests now. First, blood pressure. Monitoring high blood pressure is a major risk factor for heart disease. Regular monitoring is essential. Number 2, cholesterol levels. A lipid profile test measuring cholesterol levels, including LDL and HDL and triglycerides, which are important indicators of heart disease risk. Number 3, electrocardiogram or ECG. This test records the electrical activity of the heart and can help identify irregular heartbeats, heart damage, and other issues. Number 4, echocardiogram. This ultrasound test evaluates the heart structure and function, including how well the heart chambers and valves are working. Number 5, stress test. Also known as an exercise stress test, it shows how your heart works during physical activity. It can help detect heart problems that might not be visible otherwise. Number 6, coronary calcium scan. This test uses a special type of X-ray technology called computed tomography or CT to check for the buildup of calcium in the plaque on the walls of the arteries of the heart. the coronary arteries. Number 7, thyroid function tests. Since hypothyroidism can affect heart health, regular monitoring of thyroid hormone levels is important to ensure that your thyroid medication is correctly dosed. Number 8, blood sugar levels. Tests for diabetes or pre-diabetes, as diabetes is a risk factor for cardiovascular disease. Number 9, high sensitivity C-reactive protein. This test can measure inflammation in the body, which is a risk factor for heart disease. Number 10, homocysteine levels. Homocysteine is an amino acid in the blood, and elevated levels have been associated with an increased risk of heart attacks, strokes, and other cardiovascular diseases. Elevated homocysteine levels can be influenced by dietary factors, vitamin deficiencies, particularly your B vitamins such as folate, B6 and B12, genetic factors, and certain medical conditions including hypothyroidism. Each of these tests provides valuable information about different aspects of heart health. Your doctor can help decide which tests are most relevant and appropriate for you, considering your specific circumstances and medical history. Stress management, stress reduction techniques. Stress can negatively affect both thyroid function and heart health. If you're an A-type personality and get easily agitated, this can be exacerbated in menopause with angry, uncontrolled outbursts that lead to skyrocketing blood pressure. Or if you are anxiety prone and constantly find yourself in that fight-flight mode of survival, stress management techniques are essential. Practices like yoga, deep breathing, meditation, and mindfulness can help manage stress effectively. I will add a video at the end of this series on stress busters I find most effective. Education and support. Stay informed. Educating yourself about the changes happening in your body and the associated risks can empower you to make informed health decisions. I've made a lot of informative videos on health and wellness for women, especially in the menopausal years. Support groups, joining support groups for women going through menopause or dealing with thyroid issues can provide additional emotional and practical support. So properly managing these conditions effectively requires communication between you and your doctor. Also, your doctor or healthcare provider should be knowledgeable about the latest in hormones and monitor with regular follow-ups and adjustments to your treatment plan as needed to address the changing risk factors associated with both menopause and hypothyroidism, and a multifaceted approach addressing lifestyle, diet, medical management, and psychological support is also recommended, as I've mentioned, to improve your overall health, manage your stress, and alleviate symptoms. In the second heart health strategy for hypothyroidism and menopause, I'll dive into balancing the sex hormones that decline when you are in menopause. I will talk about estrogen, progesterone, and testosterone. And in the videos beyond that in this series, I will take a deeper dive into healing the thyroid and living post-menopause with a liver detox, an adrenal recovery plan, and a gut healing plan. All are super important if you're suffering from a precondition that is adding risk to your heart health and health in general as you age, and you want to live long and be strong to enjoy precious moments with your family, your spouse, and your friends, your grandkids, and your pets. Have a good quality of life and genuinely want to feel your best. Join me to find out how to thrive and feel vibrant again. If you found this video helpful, please like, share, and don't forget to subscribe to my channel. Cheers to a healthy heart, and I'll see you next time.